Have you ever wondered if your body might be trying to warn you about something serious? Something most people ignore until it's too late? Here's a startling truth. The vast majority of cancers are not discovered by doctors first, but by people like you, noticing small changes in their own bodies. The real problem is, more than 80% of early warning signs are missed, brushed off as just part of getting older, stress, or a passing bug. That's why cancer often goes undetected until it's already advanced. What if you could spot these red flags earlier, maybe even save your life or someone you care about? Today, I'm going to walk you through 9 key warning signs your body gives you when something isn't right. Most people overlook at least half of these. Make sure to watch until the very end, because the final sign is the one most doctors wish every patient knew. It can mean the difference between catching cancer early or facing it too late. You might be thinking, but I'm over 60. Isn't it normal to feel a bit tired, lose some weight, or have little aches and pains? Here's the myth that puts millions at risk. Cancer doesn't always begin with pain, and it doesn't care if you feel healthy most days. Early cancer symptoms are often subtle, and they can easily hide behind what we call normal aging. But here's the hope. Your body is always talking to you. If you know what to listen for, you can act before it's too late. You're not powerless, and this isn't just the way life has to be. You can spot these signs and do something about them starting today. Let's get personal for a moment. I want to hear from you. How old are you, and have you ever noticed a strange new symptom that just wouldn't go away? Leave your age and your story in the comments. I read every single one, and your experience could help someone else who's struggling right now. Now, let's get into what your body might be telling you. One of the most overlooked warning signs is unexplained weight loss. Imagine this. You haven't changed your diet, you're not exercising more, but you're losing pounds steadily over weeks or months. It might sound good at first, but this isn't the kind of weight loss anyone wants. In fact, sudden, unexplained weight loss is one of the top warning signs for cancers of the stomach, pancreas, lungs, and even the colon. Why does this happen? Cancer cells use a lot of energy. They can hijack your body's fuel, leading to rapid loss of fat and muscle. The moment you notice clothes getting loose without trying, or the number on the scale dropping for no clear reason, talk to your doctor. Track your weight weekly. Write it down. Even a loss of 5 to 10 pounds over a couple of months is a reason to pay attention. The step you can take: keep a simple weight journal by your bed and check it once a week. If you see a trend and can't explain it, don't ignore it. Another red flag your body sends up is persistent fatigue. I'm not talking about the usual tiredness after a bad night's sleep or a busy day. This is a deep, bone-aching tiredness that doesn't go away, no matter how much you rest. Some people describe it as feeling like they're wading through mud every day, or like they just can't recharge their batteries. This kind of fatigue is common in cancers of the blood, like leukemia, but can also show up in cancers affecting the colon or stomach. Why does it happen? Cancer can steal your nutrients, cause anemia, or disrupt your body's normal rhythms. The lifestyle hack here is to listen to your body's limits. If you used to garden for 2 hours and now you're wiped out after 20 minutes, don't blame yourself. Track your energy in a daily diary, and if things don't improve after 2 to 3 weeks, push for answers. A third warning sign is a new or changing lump, bump, or swelling anywhere on your body. Many people think this only matters for the breasts, but the truth is, lumps can appear anywhere: your neck, armpit, groin, abdomen, or even under the skin on your arms or legs. Most lumps are harmless, but if one is hard, doesn't move, or keeps getting bigger, you need to get it checked out. Imagine noticing a pea-sized lump on your neck that slowly grows over a month. It may be painless, but it could signal lymphoma or thyroid cancer. Real research shows that catching these changes early makes a huge difference in survival. So, once a month, after a shower, use your hands to gently check your body for anything new or unusual. If you find something, note when you discovered it and follow up if it doesn't disappear in a few weeks. Changes in your skin can be a silent cry for help, and they're often missed until too late. Watch for new moles or spots, especially ones that change shape, color, or size, or start to itch, bleed, or look uneven around the edges. Melanoma, the deadliest form of skin cancer, can start as a tiny spot, but it grows fast. There's a simple rule. If you see a mole that is bigger than the eraser on a pencil or looks very different from the others, get it checked right away. Use your phone to take pictures every few weeks to watch for changes. Sun damage adds up, even after age 60, so don't forget sunscreen and hats when you go outside. Prevention is always better than treatment. Persistent pain is another signal many ignore. We're told pain comes with aging, but cancer pain is different. It often gets worse at night or is severe enough to wake you from sleep. For example, a nagging backache could be more than arthritis if it keeps getting worse, doesn't respond to usual treatments, or is joined by other symptoms like numbness or weakness. Pancreatic, bone, and ovarian cancers can all start with subtle pain that grows over time. If pain doesn't make sense and doesn't go away, don't settle for a quick answer. Push for imaging or a second opinion. One symptom that almost everyone finds embarrassing to talk about is changes in bathroom habits. If you notice you're suddenly constipated for weeks, or the opposite, diarrhea that just won't stop, it could be a warning from your colon. Blood in your stool, even a tiny amount, is another red flag. Sometimes it's bright red, sometimes dark and tarry. Most people want to believe it's just hemorrhoids, but colon cancer is on the rise in people over 50. Keep an eye on what's normal for you, and if something changes for more than 2 weeks, see your doctor. Chronic cough or voice changes can also be early warning signs, especially for cancers of the lungs, throat, or voice box. If you develop a cough that lasts longer than a month, isn't linked to a cold, or you notice your voice getting hoarse and staying that way, it's time to pay attention. Some cancers cause coughing up blood, but often the changes are more subtle. The best tip here is to write down when the cough started and note any patterns, worse at night, only with activity, or constant. Share this with your healthcare provider. Difficulty swallowing is another symptom not to overlook, especially if it happens often or is getting worse over time. This can be an early sign of esophageal or throat cancer. It may feel like food is getting stuck, or like you have to work harder to swallow even small bites. Don't just start eating softer foods and hope it goes away. If swallowing problems last for more than a couple of weeks, or if you're losing weight because of it, ask your doctor for a closer look. Finally, the warning sign most people, and even some doctors, miss is unusual bleeding or discharge from any part of the body. This could mean blood in urine, from the gums, in the stool, or from the female reproductive tract after menopause. Unexplained bleeding is never normal, and while it can have many causes, it's always a reason to get checked quickly. One real-life story that still haunts me is of a woman who noticed blood in her urine, assumed it was a bladder infection, and only went to the doctor months later. By then, her bladder cancer was much more advanced. Don't make the mistake of waiting for things to get worse. Let's pause for a second and recap the key message. Most early warning signs of cancer do not cause pain at first. They can be subtle, slow, and easy to dismiss as just getting older. But your body is wiser than you think, and even small changes deserve your attention. If you notice anything new, odd, or persistent, don't wait for it to go away. Early action can make all the difference, and your body truly can heal when you give it the support it needs. Even small steps, tracking symptoms, making appointments, and not ignoring red flags, work if you do them regularly. You are never alone on this journey. Millions of others are learning to listen to their bodies too. If you found even one tip helpful today, please like this video, subscribe, and turn on notifications so you don't miss more life-saving advice. Share this with a friend or family member who might need to hear it. I want to hear from you. Which warning signs surprised you the most? And what other health topics are you worried about? Leave your thoughts in the comments below. Your questions could be the topic of our next conversation. If you're still with me, that means you care about your health and you want to make the most of every year ahead. I want you to know that spotting cancer early isn't about living in fear or turning every little ache into an emergency. It's about respecting what your body tells you and knowing that you have more power than you realize. Even when something feels minor, like unexplained weight loss, constant tiredness, or a nagging cough, it's worth paying attention. Sometimes it takes courage to make that call, book that appointment, or bring up your concern to a doctor who seems rushed. But you deserve answers. I have seen too many people, both men and women, talk themselves out of seeking help because they didn't want to be a bother or they felt silly for worrying. Please don't let embarrassment or fear stop you. Now, let's get practical for a moment, because I know you don't want just theory. You want steps you can take right now. Start a simple health notebook or even use your phone to track new or changing symptoms. Write down when something starts, how long it lasts, and whether it's getting better or worse. If you notice blood in your stool or urine, don't delay. If you find a new lump or your pain is changing in a way you've never felt before, make an appointment. Bring your notes. Doctors appreciate clear information, and it helps you advocate for yourself. If your doctor doesn't take your concern seriously, find someone who will. Your story matters. I also want you to know that not every symptom is a sign of cancer, but every symptom deserves to be listened to. Sometimes these signs point to other treatable issues like infections, autoimmune diseases, or nutritional deficiencies. By acting early, you not only give yourself a better chance if cancer is found, but you also protect your health overall. Remember, the earlier cancer is detected, the more treatment options you have, and the better your chances of recovery. Survival rates are so much higher when cancer is caught at stage 1 or 2 rather than when it's advanced. According to recent studies, the 5-year survival rate for certain cancers can be over 80% if found early, but drops to below 20% when discovered late. This difference can come down to listening to those first, quiet signals your body sends. If you need motivation, think about someone you love, your spouse, your children, your grandchildren, or your close friends. Taking care of yourself is also a gift to them. I've seen firsthand how early detection and a proactive approach have given families years more together, full of memories and laughter that might never have happened otherwise. As you move forward, I encourage you to trust your instincts. You know your body better than anyone else. If something feels off, it probably is. Don't let anyone brush aside your concerns, not even you. Make it a habit to check in with yourself once a month. Use mirrors, your hands, and a bit of curiosity. Pay attention to the ordinary: eating, sleeping, pain, energy, skin, and bathroom habits. Small changes are easier to fix than big ones, and if you ever feel overwhelmed or afraid, remember, you are not alone. There are millions of others navigating the same journey, and there is always hope. Before we wrap up, I want to thank you for taking the time to invest in your own health. Sharing knowledge and supporting each other is how we all get stronger, no matter our age. If you learned something today, if you feel more confident about listening to your body, please let me know by leaving a comment below. I read every single one. Your story, your courage, your questions, they matter, and they might just save someone else. Please remember to like this video, subscribe, and turn on notifications so you never miss important health updates. And don't forget to share this with friends or family members, especially those who think it could never happen to me. Your voice could be the nudge they need to get checked, take action, or even save a life. Tell me, was there a tip or a warning sign that really caught your attention today? Or is there a different health topic that keeps you up at night? I want to know what matters most to you. Leave your thoughts, your questions, or even your own health story down below. Let's keep this conversation going, because together we can make every year ahead stronger, healthier, and filled with hope. And remember, your body is not your enemy. It's your ally, always trying to guide you toward better days. Listen closely, act early, and never be afraid to speak up for your health. You're worth it.